special day for all of those. We now know things about ourselves and our community that we didn't know. Was a surprise, but it's not been here for a year. It's funny during COVID that we're not necessarily comparing one virus to another, but on World AIDS Day, we want to, at Health IQ, increase the IQ. There are subjects and audiences and obviously demographics that are affected. Um, there isn't one that will not be scathed, touched, or impacted by HIV. Tonight, we are bringing to you at Health IQ a superior thinker, a true creative soul who has the vision of being able to unravel a complicated subject with a pictorial film that gives a body of work that allows women whose voices are often in some closet, not in a funder's idea set of what HIV should feel like, but for those of us who have mothers, sisters, aunts, cousins, friends who are in several demographics, the impact of both our Constitution sexually and our Constitution as it relates to true and honest dialogue about life and its cycle, our discrimination and obviously disproportionate idea as it relates to sexual health for those who are over 21. Um, we want to call to action the beauty body of work that has been put together, an intelligent body of work, so that it's not just a look, but the intelligent body of work that a researcher who has a real PhD has found a voice in being able to provide. So I welcome none other than Dr. Megan Ibor. How are you?
Thank you. I'm doing well. Glad to be here with you, Mr. Munson Steed. So and shout out to rolling out and IQ having me here. I'm really happy to be here.
Um, no, we're happy to have you, but I think the work and when you started to think about the film, and you can say the name better than I can, where did the idea come from, and why is it so important for our community during World AIDS Day um, to really begin to unpack and create better lens set for how we look at ourselves, at our mothers, at our aunts, and just the unguessable presence of HIV in the lives of people in our community who suffer and are truly discriminated against by our own community based on ageism or any other myth that has been pushed forward, the lack of, all of us choosing to have protected sex as a methodology and a practice versus something that we encourage children to do but don't practice.
Yeah. Well, this morning I had the privilege to be on the morning show, and they too wanted to know, well, how did this work come about? And I would be far remiss if I don't share this narrative with you as well, Munson, because the genesis of the film is entitled Even Me. I was in my master's program when one of my family members, I was in school for social welfare, and my specialization was in gerontology. So I've had an interest in older adults and working with the population, but my career trajectory took a steep and shift when my personal life experience with my family member led me to feel something needed to be done in the area of sexual health and older adults, right? So it was the summer of we were in between our first and second year, and we have this year-long research project that we're supposed to do in our second year. And I just did not want to put my time and my effort into writing a paper that I knew would sit in the archives of the library and it would touch pretty much no one. I mean, the person who read it would grade it. And then I would put this effort into writing it. But the information, the content would never get to the people that may benefit from it, right? So I petitioned my department to allow me to explore ways to disseminate information because of this incident that happened with my great aunt. She was in her 80s and she was on top of her healthcare, Munson. She meticulously went annually for her checkups. She worked in the health profession. And what happened with my great aunt was she started to have some cognitive decline. She started to become a little combative, started to isolate. No one could really put their finger on what was going on with her. And she would go to her annual visits. And you want to know what they would say, Munson? Oh, it's because she's older. This is what happens when you get old. And it infuriated me because, I study gerontology and I know that that is not normal aging, right? So, or not, it doesn't have to be a part of the normal aging over the course of her lifespan. So what we later found out, just to cut to the chase, was that she had an undiagnosed STI that spread to her brain. She had neurosyphilis, right? So what was it about her interaction with her provider that, one, they didn't think to test for sexually transmitted infections? Was it her age? You can think about all of the isms, the ageism, the racism, the sexism, because I believe that they all intersected to negatively affect her situation and circumstance. So in neurosyphilis, in order for that to progress to the point that it spreads to your brain, has to be in your system for decades, for it's a long time. It just doesn't happen overnight, right? So how did her provider overlook her situation? How did they miss that? And so as I began to research sexually transmitted infections, older adults, HIV, the numbers for HIV, my jaw dropped. I couldn't believe that older adults were contracting HIV. And to me, it felt like no one was talking about it. And so I wanted to develop a tool so that I could, upon my graduation, I could hit the road running, sharing this information with communities that were unaware. And that's where I said, the best way to do this is to have a film where you get folks who are HIV positive. They look like you know what I mean? You can take this to communities, seeing a visual of someone who looks like you can relate to, and they have a message, you're more inclined to listen, right? And so that was the genesis of Even Me. I felt that the need as a change agent to do something about this. And with all of my anger and frustration with the provider that overlooked my aunt and her circumstance, I had to channel that into something positive where that I can use this film as a tool to translate research, right? And get it to the communities that can benefit from the information. You're on mute?
No,
Okay.
not me. I was just making sure the noise didn't join this conversation behind me. But truly, why don't we watch the trailer? I think it's important. So check it out. Why don't you introduce the film and kind of give them an idea of what we're getting ready to see?
Okay, so this is the trailer of Even Me. This was done quite a few years ago, but I must say, and unfortunately, it's still relevant and necessary. I would like to say, we were able to change the world and we don't need this film anymore, but unfortunately, we still need the film. And we need other interventions to help bring this content to the fore. So this is the trailer for Even Me, and we can play.
The largest group of growing HIV positive cases are women over 50.
I'm 62 years old. I still have sex. Yeah, it's not on a regular basis, but it's when I want it.
I'm going to be sexually active until they put me in the ground.
I'm 58. People think, well, grandmother's not going anywhere. I still have urges and I still would love to be loved.
It's okay to be sexually active. Sex is good, right? It's part of our human nature. But let's be real about what can happen.
We have a huge demographic that's growing by leaps and bounds. We've got this big gray tsunami coming.
I never did use condoms because I always felt that if a woman looked clean and smelled good, that they was okay.
Do you know anybody that has had protected sex for the past 30 years?
It's hard to live in a world where you're afraid and you can't talk about it freely.
Oh, I heard about this truck, so here I is.
Oh, good.
Coming to get tested.
Sure, come on in.
Okay.
So this is your first time being tested?
My first time.
There is no excuse no more. But that's the excuses that they use. I want the real deal. I don't get the same sensation. Shop for the right condoms and you will find one. Get creative with it.
Wonderful. So they all look like my relatives. So that wasn't a shocking, beautiful. But what should we know? What did you learn about these stories? What will our community be able to take away from the stories that you and the characters that you're able to present to us here?
Yeah. Munson, I learned so much during the making of this film. And if I could just preface it with saying, after hearing the stories of the women that are in this film, I mean, I felt it necessary to debrief because the stories they're heavy. And when you think about most of the women in the film contracted the virus, contracted HIV from their spouses, right? And for me, at that time, I was like, whoa, I'm a married woman, you know what I mean? But what I can tell you is making this film, the entire cast, crew, all of us, the crew, we went and got tested after, hearing these stories. And that's the takeaway, especially for women. Just because you're married does not mean that you are not at risk for contracting HIV. And I don't want to put this sense of paranoia in the air, but I think a little healthy paranoia is good for the gander, right? So getting tested is very important because you don't know your status unless you have the test, right? And if you suspect that your partner, your spouse is stepping out, there are ways that you can protect yourself that you can explore with your doctor. So, yeah.
That was a long pause for a heavy subject.
Yeah.
So
it's heavy. And, I just really feel that the perception for women, let's say 50 and older, that's the population that I really target on with this film. We focus our attention on women 50 and older. It's difficult because when you look at generationally, how we were socialized, right? And if you look at our history and how we've had to have adaptive behaviors just to keep ourselves safe, as descendants of enslaved Africans, right? Talking about sex, sexuality, your bodies, that was off limits. You would get very brutally hurt if you were caught, disseminating this information. So generation from generation, we were silenced, Munson. We were silenced. Our voices were stripped, especially when you talk about sex and our bodies. Our bodies were not our own, right? So now, fast forward, we see the residuals of that. We see the residuals of that where maybe my mother didn't talk to me about sex and how to protect my body, how to value my body. Maybe her mother didn't talk to her about it, right? Maybe her grandmother didn't talk to her about it. So working to bring information in terms of our history, where we've come from, where we are now, how our history impacts us today, right? It's empowering to know where we have come from and where these behaviors that we've had to adapt at once upon a time to keep us safe. But now we have to kind of change that trajectory in terms of how now do I move forward with having these tough conversations with my spouse or with my partner, where for the longest time I was told we don't talk about that. Yo, a woman, you don't talk about that, not out loud, the secrecy behind it, the embarrassment, the stigma, the shame. And we suffer for that. We need to be able to have these discussions, no matter how difficult they are, because knowledge is power, right? And if we don't speak it, if we don't talk about it, then we suffer for it. Yeah.
So you think about the Center of Cultural Trauma and Mental Health Disparities and the psychiatry. It sounds very traumatic. I mean, and obviously there are cultural changes that need to take place. During World AIDS Day, what would you share with, if you were speaking to a collection of Blacks 50 plus in an environment, what should they know about their sexual behavior today that you would tell them that they all need to change?
Well, when you think of it in terms of generation, right? HIV, a lot of the attention during the onset. Now you got to remember 2 months in, HIV has been here for going on 40 years in the United States, right? At the onset of the virus, it was, oh my gosh, people were falling off left and right, dying. It was this very grim picture. You would always see these newscasts with the very frail, thin lesions. Those were the images that we were seeing at the onset, right? Now, 40 years later, that you can't tell. There's medication that has advanced where now you can live with HIV, but that's not an excuse for just living freely and saying, oh, if I get sick, I'll just get a pill. That's no, because the women that are in this film, I'll tell you, Munson, we've worked very closely together and we travel together. We pre-COVID, and what I see, they'll tell you, they're like, Megan, you tell folks you don't want this virus because I have no idea what these medications are doing to me. They're toxic, my bone density, all of the internal organs. There's no way of telling what the ramifications are, of the medication. Now, I'm not here to bash the medications, but I am here to provide information. I think the key is prevention, right? And when you look over the lifespan, generationally, condoms were typically used amongst the older population to prevent pregnancy, right? So if now that you're older and you may say if it's the loss of a spouse and you're getting back into the dating scene, how do you navigate that, right? Using a condom may not even come to your mind because back in the day, that was for not to get pregnant. And I'm not getting pregnant, that's not enough. That's not going to happen. So just letting folks know that, number one, if you are sexually active, you are at risk. It doesn't matter if you knew Bob down the street for 30, 40 years. You do not know his history, right? So, and it only takes one. It only takes one encounter to contract the virus, right? So, if you have sex with someone who has HIV, you are at risk. So, I would say to older women, um, we have to find ways to communicate and to talk to our partners about past and current practices, right? And I'm going to say that again, past and current sexual practices, because what you've done before can impact your health today when I meet you, right? So, and what you're doing currently can certainly impact my health when I meet you today, and decide I want to move forward with you in a sexual relationship. So having those hard conversations up front with your partners, talking about your past, current sexual practices, and getting tested, right? Going to your providers and getting tested together. Because what I can tell you from working with older women who are HIV positive, it's unfortunate to say, but most stories I hear are they contracted it from their spouses or someone who they thought they've known for 30 years, and they would never even fathom that this person would have HIV, right? So, like I say again, knowledge is power, and we have to know. We can no longer, the stakes are too high to not ask the questions. They're difficult questions, they're hard, but learning to navigate when you meet someone new in your current relationship, because I'll tell you, you cannot guarantee for what your partner does. Now, I often hear, I'm in a monogamous relationship, I don't need an HIV test. You're in a monogamous relationship, but is your partner in a monogamous? You know what? You really have to ask the questions, and those questions are hard because we want to trust the people that we're with, right? Trust is it's a staple in a relationship. You need to have trust, but you also have to care for yourself. And I say you can only be responsible for yourself. Get a test along every year, along with your annual visit. Get the HIV test and ask the hard questions. That's what I would say.
So for the practice, and I think you mentioned the word practice, how do you suggest people, go down memory lane with a new lover to discuss their sexual practices of the past and present?
Well, again, it's hard. When you meet somebody new, you don't really want to know. I wouldn't really, but I think the question could be asked, have you have you engaged in any behaviors that may have placed you at risk for HIV, right? And then you have to know what those risks are, right? So I think a lot of this is education, knowing what the risks are, right? Unprotected sex is a risk, right? Have you had unprotected sex in the past? And in the film, I don't know if you caught what one of the ladies said in the film. She said, "Who have you known that has had protected sex for the past 30 years, right?" So I think if it's uncomfortable to say, well, what did you do in the past? Focus on the present and say, let's just go get the test, right? Because that'll tell you. And you not only want the test for HIV, but there's other STIs that you should be testing for, for women, especially, there's the chlamydia, the gonorrhea, syphilis, herpes, along with HIV, a lot of times when you go to your provider, you may feel that if they draw blood, that they're testing you for certain things. Most likely they're not. A lot of these things you have to request, right? HIV testing, In a lot of places, that's a test that you have to ask for. So I think having that information is important for women as well, women across the board, and also older women. Comprehensive STI testing is what we should be having if we're sexually active, if you have multiple partners, if you are about to engage in a new relationship and you just want to get yourself in order if you want to move your relationship to the next level in a safe way.
So, for those who don't know, you also are working in this. You found what? Because most people they would say, "Oh, this is just something we'll talk about," and I've not asked my partner to go get tested. And at the same time, particularly, you might have a partner that says, "Well, it just feels better that way, and I just want to have it that way," and that I don't like condoms. And so, um, how do we begin to change the cultural dialogue about just sex in general, unprotected sex in particular?
Yeah. Well, I don't know if you caught it, Munson, but one of the ladies actually talks about that in the film. And she was in a relationship where she was positive, but her partner was not, right? So she wanted to keep him safe, but he was like, no, I don't want to wear a condom. And she's like, no, that's not wise. I want to keep you safe and keep you alive. So it's a struggle. And I tell you, Munson, there's something about the human body that it wants what it wants, right? In the moment. But then we got to really take a couple of steps back and think about what are the ramifications of my behavior. Like, do I really want to place myself at risk? And I think that goes along with us valuing and loving ourselves, right? We, in our culture, there have been systemic forces working against us to keep us in positions where we won't have the health that we deserve, you know? And we have to recognize those forces and we have to actively work against them because it's very real. Health disparities are very real. The social determinants of health are very real, right? So we have to actively work to educate and bring awareness to our communities so that we know what we're up against and that we're prepared to fight because really it's a fight, you know? So that battle with wearing a condom versus not wearing a condom, it's a real conversation to have. But we have to think about what are the consequences of not, right? Of not having that condom. And then the other thing too, we have to consider, Roland. I mean, folks are involved in various types of relationships, right? Munson, you can have power dynamics in your relationship where you can't even broach the topic of condom wearing in your relationship. There might be, how do you deal with that? How do you contend with that, right? A lot of times we see women in the clinic that it's like, I can't talk to my spouse about that because it will not be good for me, for me physically. You know what I mean? So how do you then broach that, right? There's options. Talk to your doctor. There are female condoms and Munson, that's a whole nother show. We need to do a show about this because the accessibility, we want to talk about accessibility. Female condoms are inaccessible, but they exist. You can insert a female condom a few hours before you engage in the activity, and perhaps your partner won't need to know about it. If you're, so, but I mean, they're very expensive. I think it's like $20 for 3 of them. Now, you can go anywhere and get a handful of male condoms for free, right? So the inequities when it comes to women's health and it's astounding. And that's another show. We need to talk about that. Yeah.
Well, I think the disparities that you just described are not in the consciousness of our community. So I thank you for presenting the idea, because I think that we need to know that as a community that the accessibility to female condoms is limited.
Mm-hmm. Mm-hmm. Yeah. And Munson, I mean, there's been a lot of debate and of around the female condom. Some, you know, it's the debate had, you know, they were trying to move them to being prescription based only. Like you had to go to your doctor, have them write a prescription. I mean, where does this stuff come? You wouldn't believe that this is the world we live in. And you think about it, it's like you can walk into literally any clinic and they have a bowl of condoms. You just take male condoms, you just take them, right? So what is it in our culture about the female body, female sexual and reproductive health, that things have to be so difficult? You know, why? Why does that exist? You know, so that's something to be further explored.
Sounds like another movie, but
I think so.
yeah,
You gonna go in on it with me, Brunson? You're gonna go in with?
I'm open. I'm open. The idea, though, for me in this conversation just is that we can't assume just because HIV has been here 40 years that is a normal state of affairs. And I think that with
Yeah.
your movie, we might want to encourage or be able to supplement. And it's funny that you were talking about that, because I remember my mom's in her 80s and there was a very young man wanting to date my mom. And I was like, I don't know if your appetite and her appetite really working, Holmes. You know, I don't think that works. And
Mhm.
I'm not sure of your intentions. And I know that we've got to protect and have very, 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 very honest conversations about, um, the role that it plays, HIV in our community, new friends, new dynamics. So, how would you suggest is it watching your movie as a community? Should families on this day make your movie and some like it a conversation inside our community? What can we do? Because that number that she shared at the beginning of your documentary was astounding.
Yeah. Yeah, definitely. You know, Munson, there's so much work to do, and there are so many ways that it can be done, right? But all of these things take resources. Like, how do you do it, right? And I know a lot of the work, uh, biomedical research is the funding is, the sky's the limit for funding like that. But then when you think about these community-based initiatives, right? Who are the funders for that? Who are the folks that can provide resources for communities that need information? And I'll tell you as well, Munson, a lot of the interventions and the ways that researchers will develop tools to disseminate. I mean, a lot of them, you got to really think about who's developing them, right? And that's why I'm often asked, well, why did you go back and get your PhD? Like, why did you do that? Well, because, I was older, I have 3 children. Like, why did you go back to school? And it was important for me to go back because number one, I could see in the academy who was making the decisions that impact our lives as Black, brown folks living in the United States. And I wanted to be at that table because I know you can't tell me what's good for me, right? Like you don't know the community, you don't know, you don't know the struggle, you don't know the triumphs, and I hate the picture that's painted often about, our communities and how we need them to come and save us. We have assets in our community, right? And when I think about the lens, like my professional skill set is in social work, right? And we look at communities in terms of their assets from a strengths-based perspective, right? So when you go into these spaces where folks are coming from different disciplines, you can see the differences in our skill set and our training. And that's why I felt it was important for me to be at the table, right? And folks like me with the training that we have in social work, because the psychologists, the anthropologists, the who else is on our team? We have public health folks on our team at the Center for Culture, Trauma, and Mental Health Disparities. We have a bad team, right, of researchers. And when we come together to make or develop tools for the community, we are coming from a place where we know that community and we involve them in the process. It's not this top down. It's like we take an approach that I mean, I can't make something that's going to work for you the way you can tell me what will work for you. You know what I mean? So I struggled with the whole PhD thing, thinking I don't want to come off like I am, this superior, like I'm going to inform this intervention for you. No, I need to be at that table because I don't want you telling me what's good for my community, right? We can do this together. And if we don't continue to kind of, get into these spaces, and if they're uncomfortable spaces, because a lot of times you're not welcome there, Munson, but if we're not at the table, we will continue to have folks dictate to us what is best for us instead of us informing our own ways of enhancing, building off of the strengths that we already have as a community to make things better.
But for many who haven't seen the film, don't have any idea about practices of conversation, it's World AIDS Day here on Health IQ. You've put together a body of work, you met with these women, you've toured with this film in order to educate and increase the IQ of our community. What do you know now that you didn't know when you first started this film based on the reaction that people are having to your film?
Mhm. One of the things I learned, and Munson, I collect data when I show the film in certain audiences, because I really want to know what they're learning from the film. And one thing that was at the time that I learned when I was making this film was that you can contract HIV more than once. And that was astonishing to me, right? Because you figure oftentimes folks would say, well, if I'm HIV positive and I have a partner that's HIV positive, we don't have to worry about, wearing a condom because we're both positive and there's what can happen. We already have it, right? But I learned that there's different strains of the virus, right? There's different strains of the virus that if you are positive and you are getting involved with someone who's positive, they can have a stronger strain of that virus than you do. And then the medication that you're on might not work for you anymore because now there's a new cocktail that you might need, to kind of resolve, for your well-being, to suppress the virus. So that was one thing that I learned that I thought was really interesting. But another thing was that we as a people, we are resilient. You know, African American women are resilient, and the virus, HIV, is not the end all be all for a lot of these women, and they are empowered. And like I told you, we went out and they they were able to tell their stories. Again, me stepping aside, I wanted to help facilitate this, right? But who better to tell their own stories than these women themselves, right? So watching that transition from them hesitant to be in a film and to show their faces and to tell their stories, because Munson, that was not easy to do, right? And it wasn't easy for me to find folks who were at a stage in their life where they were willing to do that. I recall I was this student going into this support group, and I was not welcomed very nice. It was like, who is this woman, and is she going to exploit our stories, right? And that was a concern. That's a very valid concern, because when you think about the academy researchers, we call them helicopter researchers. They swoop in, do what they need to do, and they're out, they write their paper. And then what's left of the community, like, okay, where do we go from here, right? So I knew that was a real concern going in, and I was committed to this work. And I knew that it wasn't just this one project, this one film. I knew that if I got into this, it would have to be for the long haul. And because I can't turn back now, Munson. There's too much work to do. And we need the next generation. And as I say that, one of our staples, one of our pillars just retired today, Dr. Wilbur Jordan. I don't know if you're familiar, but I mean, he's been in this since the beginning. And he's one of the doctors in the film. And he had the first clinic in South LA, because there was no clinic for Black and brown folks to go to in the community. And if you were HIV positive, God bless you, because there was nowhere for you to go to get treatment, right? So Dr. Jordan just retired today, and we attended his Zoom retirement, honoring him today. And, I'm thankful for folks that have come before me and that have shepherded me into this field, but the work is not done. And like I said, my film was made of, quite a few years ago, and it's still relevant, Munson. When do we get to the point where we don't need these things anymore?
Yeah. Well, that's a question for the doctor.
Yeah. You want me to answer my own question, Munson? I don't know, Munson, because we need an army. We need folks that will dedicate their lives to disseminating this work. We need more people who will care enough to tell the truth and to have the hard conversations. Because when you look at what you're up against, and Munson, I'll tell you, my dissertation, I took this information to the church. I said, I want to go to the church, because I know we have a lot of hangups in the church where we don't want to talk about certain things, and certain things are going on, but nobody want to talk about them. And I'm a preacher's kid, right? So I think I can have license to say this. But I mean, I remember being young and having folks go into the hospital sick and then die. And then it was oh no, so-and-so had HIV, he died of AIDS. And I'm like, why was that a secret? You know what I mean? There's so much stigma and so much shame associated with HIV that we suffer for it, right? That was a teaching opportunity. You know what I mean? So-and-so died and they had AIDS. And that can open the conversation for us to have these discussions, you know what I mean? So, but instead it was like hush hush, and oh, he died of cancer, So we're missing these opportunities to affect change. And we have to first off, we have to confront ourselves. Like, what is my issue with this, right? And once you get to the bottom of your issue, then that'll free you up to have these very candid and needed conversations about sex. I mean, when I go in front of my classes, or if I'm doing a presentation with grad students, I make them stand up and I say, stand up. Now everybody said Granny is having sex, right? Because it's like jarring and they're clutching their pearls. And it's like, no one wants to say it, but we have to first find our own comfort level with a very culturally taboo topic in some circles. And then sex in general. Like no one really wants to think about or visualize their grandmother having sex, right? So it's just not a pretty picture that you want to see, that you can never get rid of in your head. But knowing the reality that grandma is a human being, grandma has needs, and a need for intimacy. And it doesn't always have to lead to sex. Intimacy can be on various levels. But if it does lead to sex, grandma knows how to take care of herself and keep herself safe from disease or illness or virus, you know? So we have to have the information. The more we ignore it, the more we're afraid to confront it, the more we suffer the consequences of not having the information.
Well, the information seems, I'm not certain. I'm very concerned. I think we are talking about the state of the Black health agenda. And obviously we need individuals like you, but I'm very disturbed that as a community, even in a pandemic, resetting our health protocols, resetting our regiments as it relates to self-care, self-love, accountability, being able to be health advocates for ourselves and our loved ones, to have a health KPI that everyone knows in our community, whether it's what's a good cholesterol level, obviously, are you getting in your annual checkup both a STI and a prostrate, or are you just getting a prostrate without getting an STI? Do you have a relationship with your primary care physician to the point where you can discuss all of the healthy health practices, which include your sexual health as well, beyond erection, but use of condoms? So is it part of the conversation that even physicians are having? So after that soliloquy, I guess that's my concern, because I interviewed quite a few health professionals like yourself, and I'm not sure that we have written on any particular wall inside each and every church and each and every health clinic 20 health key health indicators that we all can look to each and every year and know if as a community we're doing better. So I'd like for you to kind of speak to that. What would be your top 5 as it relates to key performance indicators as it relates to, is our health getting better in our community?
You know, Munson, I'm so glad you asked that, because you are actually segueing into the new study and project that we're working on at the center, which is it's a research study funded by the National Institutes, National NIH, National Institutes for Health, NHLBI, and they, Dr. Wyatt, Dr. Hamilton, and Dr. Brown developed an intervention that talks about just what you said, right? They've taken from various interventions that they've developed over the years and said, what are the important things that we need to kind of address amongst folks? Now, this is focused on folks living with HIV. However, it can apply more broadly to folks not living with HIV, because we're looking at, the project is called Healing Our Hearts, Minds, and Bodies, right? Taking a holistic approach to health. And it's through implementation science, where we're not just going into these communities and delivering this intervention and then leaving. We're actually working towards changing the dynamic in the terms of the way, the structure of the clinic, and having them keep the study going once we're gone in terms of cardiovascular disease, trauma histories, and then your HIV status, right? Mental health is so important, right? So that's one of the things that we always should consider. How are folks doing? Because, you know, when you look at the whole of the person, right? It's how are they doing mentally, physically, emotionally, spiritually, right? So through this study, there are so many concepts that are taught on anxiety, stressors, discrimination, the cultural aspects to being a Black or brown person living in, you know, underserved communities, and the stressors that that places on a person or an individual, right? So those are things that we really need to look at and pay attention to, the whole of the person in terms of their physical health, their mental health. And the study, the new film it's called TRY, accompanies this curriculum. And TRY is an acronym for Translating Research for You, right? It's my new film that's going to be coming out really soon. But TRY is a narrative film that shows folks how to use concepts to keep you healthy in your everyday life. And it's not only focused on your HIV status, but how are you eating? How are you feeding your soul? You know, how are you processing past traumas? Because we, Munson, and I'm sure you are aware, but our trauma histories can be so impactful to our mental health and how we move about in the world, right? So if you have these unresolved traumas, how do you work through them so that it doesn't impact the way that you show up in the world, and so that you can problem solve uh, with the various barriers that you face throughout your day, right? So TRY, the new film, it's a narrative. It's my debut narrative film. It's a feature length film, and what it does, it takes real stories and it uses the health concepts learned in this curriculum, and it merges them together in one visual piece, where now you can look at this film and you can focus on how they're actually using these concepts, the deep breathing, right? The meditation, the lotion methods for anxiety and calming yourself down. Because these concepts aren't readily taught, you know, in our communities, but through this curriculum, we're focusing on ways to provide tools so that when you go out into the real world, you have something tangible, concrete, and inexpensive. You know, it costs money to go to a therapist, but if you have tangible tools that you can say, okay, I can do this. I'm equipped to handle this. You know, I can lift up, which is one of the concepts that's taught through the curriculum, where you're stepping back, you're looking at a situation, and you're resolving an issue instead of reacting and ready to go in on someone, right? So the new film is a narrative film, and it shows the concepts learned in the curriculum in real life situations, making the research translational to the community, where they can actually say, okay, that girl looks like me, and she's actually using the concept that I learned in this instructional content, right? And I can see how that applies to me, right? A lot of times we miss the mark, Munson. We really miss the mark when we feel that we can just sit there with a curriculum, tell folks what to do, and then they have no point of reference on how to really use it, right? So I think that the concept of having this film come alongside the curriculum, because the curriculum is already amazing. I mean, things, the cultural pieces, and it's for Latinx and African Americans all in one group. And the film helps to make the concepts tangible for the folks that are watching it so that it can enhance the utilization of these health concepts that may not, because, when you're looking at it, Munson, it's like, we're in a pandemic. I'm isolated. And all I want to do is have that cigarette, right? But in my program, that was one of my heart health goals was I was going to stop smoking. But now all I want to do is smoke, right? What do you do in these very troubling times where we're like socially distancing or physically distancing, and you really need that outlet? How do we change the behaviors to more positive behaviors, that you can maintain your health and have the tools to kind of work through barriers and adversity to get you through? And it's not easy. I'm not by any means saying this is a magic pill, but it's a step in the right direction.
Okay, so now we got True, we got your first movie, and we've got many more. We've got World AIDS Day. What would you say to all individuals over 45 about their sexual practices and being able to address HIV as a reality that could intersect with their behavior?
I'm a proponent for a good, healthy sexual relationship, right? So I don't want to make it come off as if, I'm saying just don't do it, abstain, because we know that hasn't worked. We tell youth, they have all these abstinence programs, and that's just not the reality. So I think first acknowledging that we're sexual beings and that's okay, and what you're into may not be what I'm into, but that's your prerogative, right? So I think you can pretty much do anything you want to do safely. Yeah. And I think loving ourselves, loving yourself enough to say, I'm going to protect my body at all cost, and because I know that I have a lot to live for, right? You may have families, putting yourself first. And it's funny because I often think of the concept of being on an airplane, right? And what does the flight attendant always says to you is during that little speech they do, put your mask on first, right? And then you can help others, right? And I think it's the same concept, take care of yourself first, because as African American women, we carry a huge responsibility for our communities. We carry sons, daughters, husbands, wives, and partners. So the first thing we need to do is put our mask on first. And we need to love ourselves enough to accept the fact that it's okay. Sometimes we carry guilt with us because we feel that we have to be everything to everybody, right? But you put your mask on first, and the same applies with protecting your body first, and having those hard conversations. The 45 and older, do what you do, but do it safely. That's what I would say.
Well, it's a beautiful day. We appreciate all that you do and all that you've given us. Dr. Ibor, you've done a phenomenal job. It's World AIDS Day. She said, be safe, everybody, and protect yourself no matter what you do. And if nothing else, for every new partner and for every new experience, get tested first. Peace. I'm Munson Steed for Health IQ. Peace.